Hi, morning everyone. My name is Cedric, and it's been a long hiatus since our last CME. So today I'll be talking on Panis disease in young athletes. So Panis disease is named after the radiologist Hans Jensen Panner, a Danish radiologist. So by definition, it is a self-limiting osteochondrosis of the capitulum of the humerus, typically affecting children of pre-adolescent age from 5 to 12 years old during their growth spurt. And it should be always distinguished from osteochondritis dissecans of the elbow, which also affects the capitulum, and normally associated with history of repetitive trauma and vascular insufficiency. So for clinical classification-wise, this Panis disease in young athletes is a part of the spectrum of osteochondrosis, and it's commonly grouped with other conditions that affects the epiphyseal growth centers. And it should be always distinguished from osteochondritis dissecans, which affects older athletes. For radiological and arthroscopic classification-wise, there are three types: type 1, type 2, type 3. Type 1 with intact cartilage and bony stability may or may not be present. Type 2, there is cartilage fracture with bony collapse or displacement. Type 3, there will be loose bodies present in a joint. For pathology per se, it is theorized to result from repetitive compression type injury, normally involving overhead or upper extremity weight-bearing activities of the immature capitulum, which can result in vascular insufficiency. So normally the history that we take from patient, there will be repetitive microtrauma, there will be increased axial loading, and repetitive valgus stress, normally seen in throwing or catching sports. So to recap again, for the pathology, it involves avascular necrosis of the capitulum, leading to fragmentation and eventual reossification, and it can confuse with osteochondritis dissecans due to nearly similar radiological findings. So we walk through a bit on the clinical anatomy. The capitulum, it is a smooth and convex projection found on the inferior lateral aspect of the condyle of the humerus, and it is lateral of the two articular projections located at the distal end of the condyle of humerus, where the other being the trochlea of the humerus. And for blood supply-wise, capitulum is supplied by two end arteries, that is radial recurrent artery and the interosseous recurrent artery. Now we discuss on the risk factors. So first of all, age, where it is most commonly present in pre-adolescent age group. And Femke et al. Mentioned that the average age group for Panis disease to happen is 9 years old. Sports participation is also important in this per se, where there will be high repetition of valgus stress on the elbow. Male predominance is higher due to higher rate of participation in sports. And in studies done by Femke et al., 90% of male, in a study where 30 males was conducted, out of it 27 males, which is 90% of them, has this incidence of Panis disease. For clinical manifestation, the athletes will normally complain of gradual onset of lateral elbow pain, and there will be stiffness, swelling, reduced range of motion of the elbow, and pain worsens with activity, especially with throwing or pushing movement. So what are the assessment tools that we can use, and how do we diagnose Panis disease in young athletes? So first, when athlete present to us in sports clinic, we can use this DASH questionnaire. DASH stands for Disability of the Arm, Shoulder and Hand questionnaire, where there is this 30-item questionnaire that looks at the ability of the athletes to perform at a certain upper extremity activities. So this will help us to decide and to roughly diagnose patient's disability based on the history and also the scoring. Another simpler version will be Quick Dash. Quick Dash is a simplified version of Dash, where there's 11-item questionnaires. Okay, and imaging-wise, you can do X-ray, AP and lateral view. We will look for sclerosis, irregularity, and fragmentation of the capitulum. And plain radiographs normally can confirm the diagnosis based on the bony defect. And normally, for this condition, capitulum is most commonly involved. So in a study done by Stein and Bodecker, Schumacher et al., there are two patients with lytic defect noted in the capitulum. And Panis disease exhibits an irregular epiphysis, and osteochondritis dissecans exhibit a well-defined subchondral lesion. Okay, And in certain studies done by a client, they reported a case of deossipation of the capitulum as well. Of course, MRI is the most useful assessment tool. We can assess the size, the extent of edema, and the cartilage status from MRI. Okay, so in MRI, in a study done by Stone et al., it shows decreased signal intensity of the capitulum on the T1 series and decreased signal and cortical irregularity, as well as high signal in the joint space consistent with joint effusion seen on T1. And joint effusion also shows high signal on the T2 series. Now for treatment, how do we go about it? So the goal of treatment in Panis disease is first, of course, to relieve the pain, and then we aim to restore the normal range of motion and prevent long-term complications like chronic pain or arthritis. So treatment is divided into non-operative and also operative. Non-operative, number one, first of all, rest. We want to avoid stressing the elbow further, and no case report have described how long should we rest. So in this sense, we should always do a close follow-up of our athletes and patient, and we treat the patient, not the diagnosis, okay, in this point. So number two, immobilization. Short-term use of splints and casts. So there are multiple studies done on this splint and cast, but a study done by Bocart suggests that casting for 4 weeks to 11 months helps with relieving these symptoms. Physiotherapy is also important as it helps with the gradual return to mobility and strength. And of course, pain management with analgesics can help too. Surgical operative management is rarely indicated unless there is persistent pain or functional limitation. So complications that can arise from Panis disease is elbow stiffness, pain, inability to return to sports, and also arthritis. So prognosis is excellent in most cases as it resolves as the growth plate matures. And athletes normally can return to sports in 6 to 12 weeks if they are compliant to the rest and also the conservative management. And rarely complication like deformity or persistent pain can occur from this. That's all on Panis disease. Thank you very much.